when we talk about facial assessment and evaluation, the facial assessment is need to be organized facial assessment that ensures you that all aspects of the patient's face are evaluated during the consultation. And we cannot forget any type of part of the face or any type of detail. So we need to look skin quality, the face shape and form and contour and proportion, the facial symmetry and facial expressions, because neuromodulators, for example, works directly in facial expressions. So normally here we use this type of facial assessment scale. It's a very, sorry, some problem here. Let me see here. I normally use this facial assessment scale when where we can, with the patient, qualificate in worst or better, and better or worst, number 3. 0 is a very, very interesting radiance and glow of the skin. So the patient with 0 do not need any type of treatment. The patient with 3 is a very bad facial radiance and glow. So we and the patient together, we can mark these little balls and classify the patient in skin quality, facial shape, proportions, symmetry, and expression. So we can determine the main concerns of patients to when the patient are looking for aesthetic treatment. So we can develop with this scale some benefits, systematic and standardized assessments, so we can determine in those classifications the severity scale, the severe or soft problems in those areas. The assessment covers the entire face. That's very important. The patient feels part of the process. In this moment, the patient maybe marks some severe, for example, severe volume loss, and you do not see, we are not seeing a severe volume loss. So understand the problem, the patient sometimes mark with a very severe something that we are not able to see this problem. So we need to add our opinion, our medical vision, our aesthetic vision with the patient expectations and the patient vision, so we can, with this, determine the priorities that we can view both patient and us to determine the treatment plan. And it's very interesting. So we can determine the skin quality and classify the skin quality that depends of the contrast, color, and the imperfections of the face. So we can classify the patient with the patient, make their own opinion. So we can classify the firmness of the skin, the elasticity and the hydration and the tightness of these ligaments. So we can determine this with the patient. The sagging is the lateral aspect of the face. So a very severe classification may be a point to us that we need collagen stimulation. So we can think about technologies like ultrasound, microfocus ultrasound. We can think about some injection of particulated biostimulator. We can try to develop some diagnosis in this moment. So sometimes when we are trying to look for facial shape and volume loss, we can classify the patient severity in different types, and we can reset volume and projections with hyaluronic acid. We can refine the face. We can put the hyaluronic acid in the exact position that the aging process asks for us to do that. So it's not something aleatory. We need to understand that the fillers are not injected aleatorily in the face. We need to understand the aging process. We need to know how we diagnose the losses, the loss of tissue in the face to determine where I need to put the hyaluronic acid in the deep plane, in the superficial plane, in the front part of the face and the lateral aspect of the face. So that's very important to us. When we talk about proportions, we are talking about reset shapes and projections with hyaluronic acid too. So sometimes we need to see the patient in the profile point of view to recreate the profile of the patient, point of the nose, point of the chin and lips, all in the same aesthetic plane. It's very important to determine. We can determine symmetry. We need to see and look for symmetry or asymmetries in the patients. It can be congenital or acquired by traumatic or other types of deformities. We need to understand that. Sometimes we can see some masseteric hyperplasia because the patients normally bites more in the right side of the left side. So we need to do that, understand that. We need to look for the static lines, the wrinkles, because the neuromodulators probably are not the solution. We need to looking for biostimulators, lasers, skin boosters. We need to think about the skin quality, the collagen of the skin that we lose during the aging process. So we need to recreate this. Maybe sometimes neuromodulators are important, are coadjuvant in the treatment plan. So we need to understand that. The dynamic lines now, it's neuromodulators objective. So the neuromodulators now will work paralyzing the muscles to decrease the dynamic lines and relax the muscles to decrease the dynamic lines. So that's a very interesting. So we need to understand that the skin quality is very, very important today for the patients. Normally, it's understand that we cannot put fillers in the deep planes or superficial planes and not work with skin quality and skin rejuvenation. So we need to understand the skin quality is a combination of texture, color, uniformity of the color, and elasticity, the firmness determined by the collagen inside the skin. So the first 2 millimeters of this skin is very important to determine this. Other thing is facial shapes. Those different facial shapes determine maybe where I can or I cannot put some hyaluronic acid to develop different shapes of face. So normally we have five different types: the type oval, round, square, triangular, and heart face. Different types of face that we normally do not make some great alterations, or we can transform square faces in triangular faces. We can transform triangular and square to be more masculine or more feminine. So when we transform square faces and triangular, we are softening the aspects of the face and transforming more feminine face. And when we transform the face in more square, we are transforming in more masculine faces. So we can determine that. The facial contour and proportions are very important to assess these proportions and contours to evaluate the patient from different angles. So to try to understand that, we need to see the patient in frontal view, profile view, 9 degrees, and a view in the 45 degrees when we determine this line, this OG curve that determine the malar face. So here we can see a different photo. It's a stereophotogrammetry. It's a facial scanning that we can obtain from the patient. We have the patient in all different positions in the computer to analyze all the aspects. We can put the patient in the profile and in the 45 degrees angle and frontal angle in every position that we need to see. Here again, the same thing again, we can determine the frontal view, profile view. We need here, we can obviously understand that this patient needs mandible and chin. We determined that we need a little bit maxilla to put the upper lip in the right position. He needs some mandibular angle and chin. He has some deformity in the middle line of the chin. So that's very important to plan every aesthetic treatment offline without the patient in our office.